Thanks so much for joining me on the podcast here today.
Thanks for having me, Jared. I'm excited to be here.
I'm super excited to have you on. Let's dive right in. I'm going to go kind of with some big questions out of the gate here, which I'm excited about. And to kind of kick things off, I mean, doing the research before this episode, your story is incredibly moving, from facing the stage 3 breast cancer diagnosis at 35 to really pioneering a new model of post-discharge care. Can you take us back to the moment when you decided to turn your experience as a patient into a purpose?
I I don't know if it was like a light bulb moment or if it was maybe a journey, but I think, I'm a clinician also. So I spent 18 years working in emergency medicine as a PA. And I always felt like it was so hard to get patients what they needed. And when I became a patient, at 34 and then, had the experience the second time at 38, I also, felt it on the side of being a patient. And I think for me, I saw that working, in within a big health system and that big infrastructure, it took a really long time to get things done. And I, one, have the emergency medicine personality, so I want things like really fast. And I wanted to do really big things, and I wanted to do them at scale and do them quickly. And I think I reached this point where I was like, I don't, you know, I don't know how much time we have and in this world, and I want to, do a lot with it and do really meaningful things with my time. And so that was right around, it was actually right around COVID. And there was this time where people were actually able to order stuff off of Amazon and get it in 2 days, but they couldn't get healthcare in their home. And I was like, something is wrong here. Let's figure out how to fix this.
I mean, just going through what you went through, though, it must like change your outlook immensely. You and I were chatting about this kind of before the conversation,
Yeah.
how it kind of puts in like something like failure, right? Like it changes your mindset around failure and what you end up doing. So, how did that? It's cool that that kind of led into why you wanted to build this. How does it shape how you lead at the company and your vision for healthcare more broadly?
Yeah, I mean, listen, we all have failure. We all have bad days. We all get stressed out. Doing a startup is really hard. I think maybe going through there was a point actually at the end of my treatment when I was, the last time around I had a lot of treatment, and towards the end I couldn't even get off my couch. And I remember laying there, and I had this like clarity of time and what I wanted to do with my time, and this idea that failing was so much less scary than not trying. And then on the other side of it, when things happen now, when a deal doesn't work out the way I want it to, or we have a failure, or we have a challenge. I think, I overcame that. We're going to overcome this challenge. We're going to overcome this hard day. And so I think as a leader, I really try to just lift everyone up and say, you know what? It's okay. We're going to get through this. It's going to be hard. We're not doing this because it's easy. We're doing this because it's hard.
You're tackling such a massive problem. But what I would love for our audience, some are probably aware of the problem, but many are probably still learning about it. And maybe this will be what I hope is this is also for many of them is the first time that they get to dig a little bit deeper. What makes post-discharge care such a critical but often overlooked part of the healthcare journey?
Yeah, it's a huge gap that exists right now. So essentially, what we do, and maybe I'll start with that, is we provide 24/7 medical support for patients from the time they leave, by the time they're discharged, to the point where they have full recovery. And we do this through our medical practice and through our technology. And, it kind of started throughout my career as an ER provider, where we would see patients coming back and think, oh gosh, like if only they had started those antibiotics sooner, if only someone had double checked their meds, or, all this could have been avoided. And, they're discharged without the right resources or without the right follow-up, and just to come back again. And, when patients leave, they essentially go from 100% where they have, you know, when are they going to take their medicine done for them? When do you get up and walk the hallway? When are you going to, do your physical therapy. Everything's decided for you when you're in the institution. Essentially, you walk out of the doors and it all falls on the patient and their caregiver until they get to that follow-up. But in the US, the average time to follow up is 29 days. And what I know from work I've done in the past and what the research shows is we have to get to patients within the first 48 to 72 hours to really make a difference in their outcomes. And so there's a long period of time where patients are really left to their own devices and they just don't do well. And, things just are recognized too late. And it's a huge, huge cost on our avoidable cost on our health system and, disease exacerbation, all sorts of really unhappy things that I know we can do better on. And I actually did this, operationalized projects before, showed it. And, now we want to do it at scale for everyone everywhere.
And part of how you're doing that is it wouldn't be a podcast today if I don't mention these two letters, but AI, right? You're leveraging AI today to double your reduction in readmission rates. Can you share a bit of what's driving that, and what kinds of outcomes that you're seeing today?
Oh, yeah. I love to talk about our patients. I still see our patients. So we're using AI in a few ways. So I think AI has a lot of purpose. So one, it can help with automation and operations. And so we're using it, to help with our clinicians with documentation and with just getting the patient's appointments. And then we're also using it to recognize, really personalize and recognize patient acuity and care planning. And then beyond that, we're using it for helping enhance the care journey for the patient. So, what happens? I mean, maybe if I can talk you through what happens with the patient when we see them, that might be help articulate it a bit more. So, essentially, we receive a patient, and that patient's seen by a provider. So we don't use AI to replace the human component of healthcare, but I almost say to enhance the human component of healthcare. And so the provider sees the patient, and we use AI to help gather all of the personal information about the patient. So not just their medical record, but their social determinants of health, their personal capabilities, maybe some other factors that we're able to collect from the video visit that we have, and things that we can see about the patient and how they're going to manage their recovery. So we're able to risk stratify that patient. And based on that risk stratification, we create a care plan for that patient. And then we have and for that care plan it includes multiple interactions with that patient beyond that first visit. And based on how they respond as we interact with that patient, we can dial up or dial down the intensity of the interactions until they recover back to their baseline, and we can hand them back off to their care team. I think that's the best way to articulate how we use AI. Does that make sense?
Yes, and let me just say, I love when I have guests on, and I mean, this is most of the guests still, but that unconscious competence where I just ask you something and it's like, you just perk right up and then you're immediately start going into it. I love that stuff so much because, I mean, it just shows how much time you've spent into building this and thinking about it from all the different angles. And your explanation of how you're leveraging AI is much better than what I often hear, right? Because the new thing is just slap it on the deck and then put it out, right? Which yeah, it's interesting. Now, I just got back recently from the HLTH conference in Vegas, and there's a bunch of different conversations. When AI was brought up all the time, right? How are we going to pay for healthcare better was another one. But then kind of the third one I kept hearing about was continuously, which we've heard for years, is the staffing shortages. And many people know that these hospitals are facing unprecedented staffing shortages. So how does Dimer Health, how does that support those overextended systems?
Yeah, I mean, right now, and this area of transitional care, I think it's really almost a product of that challenge. And I think the reason it's coming so much to the forefront is because of the constraints put on our health system. So we know that healthcare institutions, they're pushed for shorter length of stays. So patients are getting discharged sooner, and then they have a hard time following up. And so they're left in this period of time where their health state is in flux and in a vulnerable, variable state for longer. And and traditionally it's been pieced together with resources that are case management, social work, nursing from the hospital or the discharging facility, and the offices, the outpatient offices, and trying to bridge that together, piecemeal. And I think it's done, enough to get by till now. But and I think all of those components are really important, like the social work, the nursing, the case management. All of those are integral part of the structure. But the piece that's really missing and that's emerging, that we really are trying to define, as this transitional care medicine. And we're defining it almost like a new specialty in medicine, like where hospitalist medicine emerged like 20 years ago because of the same type of constraints. Like primary care couldn't get in and see and discharge their patients fast enough in the healthcare institutions. The same problem now is emerging in the post-acute space. Hospitalist medicine doesn't go outpatient, and the outpatient providers are really maxed out, and it's very hard for them to do everything they need to do specifically for these patients. So really taking care of them in their unique, vulnerable, transitioning state with proactive, personalized care is its own specialty emerging on its own.
Do you think we'll actually see then, much like hospital medicine, like it'll actually be not just, kind of something that's up in the air. It'll be titles that uh, like clinicians will end up holding?
I mean, I don't see how it couldn't, and maybe it's because, I'm a carpenter and everything looks like a hammer, but, we're calling our providers transitionists, and our outcomes are amazing, like, and I can give some examples of, like, where we're making a difference, but, we're reducing readmissions in our patients by 68.7%. Our patients love it. Our NPS score is 94. So and that's like really, really high in healthcare. We're getting comments from people like, you guys are like guardian angels. How come healthcare hasn't always been like this? Just like the most beautiful comments. And honestly, because startup world is hard. And so we do have hard days. When we do, I'm always like, let me get on and see patients for a little while, because it's the most beautiful experience. Like they are so grateful, because I think every single person that we've encountered, from investor to stakeholder, has the story of either themselves or someone they care about, where they were discharged and they had a question that they couldn't get answered, or they had a problem and they ended up back in. I had a readmission, and I have been working in the field for a long time. You think I would know better, but I didn't know better. One of the great thing that we've discovered is, I can give like a general example, and then I can talk about an actual patient that we saw. One of the coolest things that happened right away that we noticed, we started working with a few surgeons and that do laparoscopic procedures, and almost every patient that we saw after their surgeries was complaining of this like right shoulder pain. And one of the things that happens, and I won't like get too technical or boring, is when you insufflate a belly with CO2 during the laparoscopic procedures, it's almost like you get, I don't know if you know anything about surgery, but it's almost like they make you look pregnant, and then they go in with their like camera and their tools, and they do like almost like they do their everything under like a video game, almost under the dome of your belly. And then when they're done, they pull out the CO2 and close you up, and then you're done. And it's good because it's not an open surgery, less infection. There's a whole bunch of good stuff about it, but there's always a little bit of CO2 left. And that causes irritation to the phrenic nerve. And that phrenic nerve causes pain to the right shoulder, to the back, to the chest. And these patients, it can last for like 48 to 72 hours. Patients were complaining about this. Some patients in certain demographics were thinking that they were having chest pain. We're going back to the emergency room, and some patients were thinking they were having complications from their surgery. People were getting admitted, getting workups, and we're like, wait a second, this is silly. Like this is because of the phrenic nerve pain, but nobody was seeing these patients during this time because they were home and they were discharged and they didn't have follow up. And so we actually found some studies that showed that if you decrease the pressure in the belly during this time, during surgery, patients don't have as much complications. So we shared this with the surgeons. They actually met together and they're like, you know what, we're going to try this. And now none of their patients complain about it after surgery. So it's like really cool. Like we're getting these insights that are really, really amazing.
I love
Right?
how much you love this so much. I mean, you have to. You don't start a business unless you are absolutely in love with the problem you're solving, and in your case, the patients that you're helping, right? Um,
Yeah. I
it's
really
so
love people.
I just love how excited you're getting when explaining the examples and everything. I wish more people would like, I know a lot of people love their business, but I really appreciate the level of excitement you're sharing here, like, when you're talking about everything. It's awesome. It's really
I can tell you about another cool case.
Please tell me.
Okay. So we had a woman that we saw. She actually was from a different institution, and she was actually 70 something year old female. There's actually two cases, and they're totally different. So maybe I'll try to tell you them both quickly, because I don't want to take up all your podcast time. But she had, was otherwise healthy up until this point, had an appendectomy while she was in the hospital. So she didn't have any primary care or any doctors. She never saw doctors. And she had appendectomy. They discovered during the hospital stay that she had high blood pressure. She didn't totally agree with them, but whatever. They started her on blood pressure medicine, discharged her home. Her surgeon referred her to follow up with us, and we saw her a couple days later. And I actually saw her. She was very funny. And we went through the whole visit, and I was like, let me check you out. So we did our exam, and she's like, I've gained like 30 pounds since I've been home, which is not normal. And I was like, okay, what's going on? She's like, my legs are super swollen. And so what happened was, and her legs were super swollen. And they started her on a blood pressure medicine that was a great blood pressure medicine. So it wasn't the wrong thing. But a side effect is peripheral edema, which is swelling in your extremities. And it's a rare side effect, but it's a side effect. But they'd given her a follow-up to a primary care doctor, but no appointment to this primary care doctor. She didn't know this primary care doctor and tried to call and was not able to get in to see the primary care doctor. So she was going to go back to the emergency room, and which, was plan B if plan A didn't work. But plan A was to cut the dose of the medicine in half, keep an eye on her blood pressure. And, within days, her weight had returned to normal. The swelling had gone down, and she was like happy as could be. Like, they were so happy. So, and then we got her into her doctor after that to follow up, but she did not have to go back to the hospital and have a big workup and get admitted, which would have otherwise happened. So that was great. Another example was a woman that we saw, and this is not even a medical example, but she was a patient that had a knee replacement that called at 10:30 at night, worried because of something with her bruising. And in her evaluation, she needed some education. She felt so much better, but the provider realized that, are you home alone? And she started to cry and said, yeah, I've been home alone. I haven't slept in a week. My daughter comes and stays with me during the day, and I don't want to put her out at night, but I'm so scared to go to sleep at night. And I've been so worried about this. And now that you've explained it to me, I feel so much better. I think I can sleep. And the next morning we checked in on her, and she was like, this has been the best thing. I wish I had known about this. And, it was just like so heartbreaking to think that, there's people that are that alone, and I just think there's no, we all deserve to have that peace of mind, right? Like, to know if we have a question or if we're scared or if we're unsure. I never want any patient anywhere to ever feel like they can't ask these questions. And, you know, sometimes it's serious, sometimes it's not, but they should have something there. So, it was really beautiful. It's just beautiful.
I love it. Speaking of beautiful, I love the pictures of is that your daughter?
Yeah, but she's like 15 now. Thank
It
you.
that's awesome, okay. Always keep those up, though. Uh, all of these paintings, by the way sorry, I just had to you
Thank
said the
you.
word beautiful, and I'm seeing all this, like, artwork and everything and family photos, and that's awesome. Is that
Thank
something
you.
she made?
No, that's something some of the stuff I made. I'm a little artsy. I did art school first before I went into science.
I like it. I like it. That's awesome. I want to shift focus a little bit as we wrap up here, by the way. And I really appreciate all the stories you shared. Wish more people would share these patient stories because they're so important, right? To tying everything back to why you're building this and what you're building in the first place. So
Sure.
when I was going through kind of research before our episode, I realized that you have one of my favorite investors of all time on your cap table and Bill Ackman. You also have table management. So both of them are backing you. I'm a huge like Bill Ackman fan though for his investments and he also like I told you one of my favorite quotes, right? In order to be successful, you have to make sure being rejected doesn't bother you at all. That is my number one favorite quote of all time. And he also has one where it's like, if I believe I'm right, I will go to the end of the earth to prove that I am right. I also really like that one, something like that. Um, but so like that's a strong signal of confidence in your approach, having like someone like Bill Ackman in table management. So how has their investment influenced your trajectory? And is there anything that you can share that you've learned from either one of those, either Bill Ackman or table management?
Well, I think so we actually had 3 investors. We had Tech Aviv, Silver Circle, Bill Ackman's Table Management. And I think all 3 of them, I mean, I think this is a problem that really resonates with everyone. So, you know, that I think that piece of it, like this this area of the post-acute period where, our healthcare system, there is this gap where people just kind of fall off the cliff is something that I think we've all experienced, and including the people that we spoke with at all of those firms. And, we've had such great traction. We've been growing so quickly. We have both the medical practice and the software. So we've been taking care of patients, and just the growth has been overwhelming. And I think, all 3 of those investors have been amazing. Like I always hear horror stories about investors, and really, like, I feel like we just have more awesome teammates, and they've just really opened doors for us. And, I think it took a little while. I mean, we learned a lot along the journey, and I think it's a hard, and we started raising back in 2022, and it was a hard, like, investment. It was a hard time to raise, and it required us to do a lot of bootstrapping and, like, do a lot of proof points first, so that by the time we got the funds, and we really put together a really solid business model and a solid company that was getting really great results for people. So, I think that we did have to prove ourselves, and so we did, and then when they invested, they felt really good about their investments.
I love it. What's next that you can share with us here today as we wrap up?
I mean, we see ourselves, right now, a patient comes into the emergency room, gets admitted, and then it ends for them. And then they have to follow up at some point in some time with their care team. And we want to see transitional care medicine be the next thing in that continuum. So they go into the hospital, they come out, go to transitional care medicine, and then follow up with their care team. So they're never left alone. I always tell patients, like, think of your doctor having one hand, we grab the other, we'll hold on to you, and then till we hand you back off to your care team, so you're never alone. Almost like how orthopedics has physical therapy, it's just not an option. We don't want to be an option for after discharge. So we're really working on building that out right now. We've got lots of exciting growth coming. So hopefully you'll see some things soon.
I'm excited for you. Definitely stay in touch and let us know of any announcements. But I really enjoyed our conversation here today and look forward to future ones.
Thank you. So nice to meet you, Jared. Thanks for having me.